Hi, on behalf of Palmdale Regional Medical Center, I would like to welcome you to our Total Joint Education class. Before you begin, please be sure you have read your Total Joint Education booklet. If you have not received a booklet, contact your surgeon's office, or you may obtain a copy by contacting me at 661-382-5051 to have a copy made available for you to pick up. It is recommended that your support person, or as we will call them, your care partner, be available during this presentation. If your care partner is unavailable at this time, please be sure to share the Total Joint Education booklet with them and any information learned throughout this presentation. Before we begin, please note that completion of this course is recommended prior to scheduling your surgery. This presentation is approximately 1.5 hours long. Please have your Total Joint Education booklet or a downloaded copy available for reference. You may pause the video at any time. After you have completed the presentation, be sure to submit the attestation form provided at the Palmdale Regional Medical Center website to receive credit. If you experience any problems throughout this process or have additional questions or concerns, please contact Christina Phillips at 661-382-5051 for assistance. Let's begin. If necessary, select pre-surgery testing may be recommended. Your surgeon's office or the pre-admit nurse will communicate any required testing for you prior to your surgery date. Once you have scheduled your surgery, you will receive an email from UHS with instructions to create an account on our patient portal. Please fill in the requested information. The pre-admit nurse will review your information with you prior to surgery. Palmdale Regional Medical Center is proud to partner with the listed orthopedic surgeons to provide you with education to improve your hospital experience and recovery after surgery. This presentation will provide a generalized overview of how to prepare for your upcoming surgery, what to expect during your hospital stay, and how to care for yourself once at home. Please note that your surgeon will provide more details regarding your individual surgical plan. It is important to follow the plan as directed by your surgeon. What is a total hip arthroplasty? A hip replacement or arthroplasty involves removing the diseased ball and socket of the hip joint and replacing it with artificial materials. What is a total knee arthroplasty? Also known as a knee replacement, a total joint arthroplasty is a surgical procedure in which damaged parts of the knee joint are replaced with artificial parts. The surgery is done by separating the muscles and ligaments around the knee to expose the inside of the joint. The reason you have sought out to have surgery is that your joint's cartilage or cushion has deteriorated over time, leading to severe pain, limping, stiffness, weakness, swelling, and limited mobility. When alternative therapy fails to alleviate these symptoms, replacement of the joint is recommended as the next step. At Palmdale Regional, we have identified 3 goals that we hope to accomplish prior to surgery. Our first goal is to prepare and empower you for your surgery. Research has shown that patients experience better outcomes after surgery when they receive appropriate education and explanation on how to prepare for their upcoming surgery, what to expect upon arriving for surgery, and how to manage and care for themselves after surgery. Within the Total Joint Education booklet, information is made available to help explain what having surgery entails. Your surgical experience involves many members of a healthcare team other than your surgeon. Being prepared to engage and answer questions about your health history and current state of health helps our healthcare team better serve you. Ideally, you will feel more confident about your upcoming surgery and empowered to do the best you can to prepare your mind and body to achieve the best outcomes you can during your recovery. Our second goal is to establish realistic expectations. You may have spoken to family, friends, and/or colleagues about having your hip or knee replaced, or perhaps you have had previous surgeries. Regardless, it is important to remember that each person's surgical experience is their own. It can be difficult to predict how any individual will respond after surgery. However, research-supported surgical and medical practices support the treatment plans in place for the sole purpose of trying to provide the best outcomes possible. With this being said, it is important to note that all individuals recover at their own pace. You will be provided expectations about your ability to walk and move around. pain management techniques, and ensuring proper care for your new joint. Lastly, it is important to embrace your role as an active participant in your surgery. Being an active participant means acknowledging your responsibility in ensuring you are prepared for surgery and are ready to commit to continuing the plan of care after surgery. We will further discuss the various components of your surgical experience and steps to prepare for a favorable recovery. Ideally, you will be completing this class within 2 to 3 months from your surgical date. Firstly, do not panic if your surgery is sooner, and it is likely that your surgeon or primary doctor has already recommended many of the steps listed. As early as possible, it is important to plan for help at home for at least 2 weeks after surgery. More about care partners will be discussed. Take your time to read through the timeline and pause the video if necessary. Additional information will be provided as we move forward through the presentation. At the first mention of surgery, it is important to gather a timeline from your surgeon on what needs to be accomplished and when. For example, at 2 months before surgery, it is beneficial to focus on becoming the healthiest you can. Please note that beginning a drastic diet is not an ideal plan. However, if you are someone who drinks sodas throughout the day or consumes a high amount of carbohydrates like rice, bread, potatoes, or pasta, then exchanging those items for water and fruits or vegetables would be a beneficial step. Remember to discuss nutritional advice with licensed providers to ensure you are meeting your body's demands. Too little of something can be just as harmful as too much. Make sure you are getting what you need to maintain a healthy lifestyle. Quitting smoking can be challenging. It is important to communicate any difficulties with nicotine or nicotine products with your surgeon and/or primary doctor, and to seek appropriate treatment plans. Start exercising as best as you can. The Palmdale Regional Medical Center website has a printable link for the prehab exercises available, and they are listed with directions in this presentation. Here is a list of various exercises we recommend. It is important to consider the limitations your new joint may have in the beginning. By exercising the rest of your body, you will be stronger and more able to move around, which will make your recovery easier. Prehab exercises are designed to strengthen your body in an effort to improve your mobility and activity after surgery. These exercises can be completed as instructed while sitting in a chair or laying in bed. Consider establishing a routine that incorporates these exercises now so that you may benefit later. Please remember to only perform the exercises at your comfort level. If your specific joint is unable to tolerate an exercise, then consider an alternative exercise that is more tolerable. If you experience any injury at any time, it is important to inform your surgeon immediately. Remember that any activity is better than no activity. Start slowly and stay safe. Be sure to wear proper attire when performing exercises, especially non-slip footwear with good support. Be sure to inform your surgeon of any procedures or dental work that you have planned within 6 months of your surgery. Also, avoid piercings and/or tattoos that may increase your risk of infection after surgery. As noted, your care partner can be vital to your success long-term by ensuring your immediate recovery is successful. Your care partner should be a family member, a close friend, and available for at least 2 weeks or more after surgery. Think ahead to the limitations discussed with your surgeon, like driving, standing for long periods of time, showering, etc. It is important to keep your new joint safe by following the limitations in the beginning so you can ensure a safe recovery and reduce complications and/or injury. Page 6 of your booklet discusses care partners, and they are mentioned throughout the text. Please note that not having help at home may require postponing your surgery until help is available. Plan ahead with your selected care partner and surgeon for an ideal time to schedule surgery. A list of useful equipment is provided here. Page 9 and page 25 provide more details on the type of equipment that may be useful in your recovery. It can be useful to bring the total joint booklet with you to your appointments to discuss appropriate options for you. Your insurance company will be able to tell you what items are covered by your plan. Many items may be purchased at a medical supply store, a retail pharmacy, or online. If you are able to borrow equipment, Be sure the equipment works properly and is cleaned well with a diluted bleach solution. Secure any recommended equipment by your surgeon prior to surgery and be familiar with its use. Within 2 weeks of surgery, you will likely have your final preoperative visit with your surgeon. At this visit, additional instructions for your surgery will be provided, along with information on any home health or rehab therapy arrangements. This is the time to begin preparing your home. Helpful tips on home preparation are also available on page 8, including a checklist to help guide you. Many of these questions are similar to the questions your physical and occupational therapists will ask you after surgery, so it can be good to fill in the blanks and bring the booklet with you to the hospital. Take note of the medications your surgeon instructs you to take, as well as filling any prescriptions made available to you. If you are under the care of a pain management specialist, inform your physician of your upcoming surgery to make sure your pain management is adequate. It is important that your surgeon and pain management specialist are each made aware of the pain management plan to ensure you are receiving the appropriate medications for your recovery. Your surgeon will instruct you on how to prepare for your surgery. It is important to follow the instructions. If you receive different instructions, please inform your surgeon immediately. Please note that it is important to only take the medications instructed. Many medications can negatively impact your surgery or recovery. Your surgeon will review your medical history at your first visit. Please be sure to inform your surgeon of any changes to your medications or health. Your surgeon will instruct you on which medications can be taken the morning of surgery. When you arrive to the hospital, it is recommended that you provide a list of all your medications, including the name, dose, how often you take it, and the last time you took it. You will be expected to walk once you are able and stable to do so after surgery. Please wear loose-fitting and comfortable clothing that is easy to dress in and remove. Closed-toe shoes with a heel or back should be worn. Walking in sandals or flip-flops may increase your risk of falling. Please ensure your shoes have a slip-free rubber bottom. If you have a container for dentures, please bring it with you, labeled. If not, one will be provided. Please wear required vision and hearing aids to ensure you are able to communicate clearly with your healthcare team and able to read all literature provided to you. If you require translation, services are available through our translation service called MARTI. MARTI is a complimentary video communication service provided as needed to assist you in your knowledge and understanding of your healthcare services and needs. Please inform the pre-admit nurse if you will require these services. You will require your ID and insurance card, and a method of payment if needed on the day of surgery. Leave all other valuables at home. Please provide the list of medications, including the last time you took your medication. Please bring your walker, labeled with your name and phone number, with you so that our staff may ensure it is adjusted to your need. Please have your total joint education booklet with you in case you have questions or would like to take notes. Staff will be happy to answer any questions for you. All of your personal items should be able to fit into a small bag. Please make sure you have what you need in the event you stay overnight, including your cell phone and cell phone charger. Your surgeon will provide instructions on how to cleanse your skin prior to surgery. Please follow the instructions and purchase the items listed by your surgeon. Surgical practices are ever-changing as new evidence emerges through research and study. Your surgeon will inform you of when you should stop eating and drinking. For many, this will be at midnight before surgery. For some, you may be allowed to drink water up to 2 hours before your surgery. Follow the instructions that you are provided. Before your surgery, you will be advised by the pre-admit nurse on arriving to the hospital and which entrance to use. This information provides you with what to expect on the day of surgery. Additional information is provided throughout the presentation. Please note, family and/or visitors may be restricted during certain times of the year, as seen with COVID-19 and flu. If you have a question regarding family or visitors, please call the hospital at 661-382-5000. Please have your ID card, insurance card, and a method of payment available should co-pays be required. Paperwork will be provided for you to sign. You will also be provided a patient identification band. Please make sure your name and date of birth are correct. A nurse will be assigned to you in the pre-operative area. Your vital signs will be taken and you will be escorted to a room. A gown and any necessary items will be provided. Several consent forms will be reviewed for signature. If required, blood work may be collected. You will meet with your anesthesiologist, your surgeon, and a member of the operating room team. The operating room can be an intimidating place. You will see lots of equipment and bright overhead lights. The staff recognize that you may feel nervous, and they will do their best to put you at ease. They will assist you to the operating table. Your anesthesiologist will administer the appropriate medications early into your arrival, and your surgery will begin soon after. After surgery, you will be transferred to the recovery area, also known as the PACU. You will be monitored and medicated as appropriate for pain and nausea. Once stable, your care partner or visitor may see you. Please note that only one visitor is allowed at a time. Again, be advised that visitors may be restricted during high-risk seasons such as COVID-19 or flu. As said earlier, you will be monitored and medicated. A breathing exercise device called an incentive spirometer, or IS, will also be reviewed. The purpose of the IS is to help expand your lungs to reduce your risk of pneumonia. It is recommended to perform the breathing exercises at least 10 times an hour. Be sure to take breaks in between the exercises to avoid becoming dizzy. Once you are determined able, you will be moved to a separate area of the PACU. Here, you will be allowed to eat and drink as tolerated, and your physical therapy and occupational therapy will begin. A nurse will monitor you and discuss with your surgeon your progress. You should anticipate being able to go home on the same day of your surgery. If it is determined that you should stay overnight, you will be assigned a room and transported to the unit by a nurse and/or transporter, where you will continue your recovery in hopes of going home the next day. This is the reason we have recommended having a small bag with your belongings, just in case you need to stay the night. Please note that a majority of our patients do go home on the same day. If you have questions or concerns about your discharge plan, please speak to your surgeon early so that he or she may provide more information. Prior to surgery, you will receive guidance from your surgeon's office on how to care for yourself once you are at home. In this presentation, we have and will discuss further at-home care techniques. Please remember, a home health agency will visit you at home 1 to 2 days after surgery. They will review how to care for yourself and evaluate your home for safety and proper use of equipment, including walkers and bedside commodes. Home health will be arranged by your surgeon's office, and this will include a nurse and a physical and/or occupational therapist. Please note that you will require assistance at home for a majority of the tasks we have previously discussed, like driving, cooking, housework, pet care, errands, etc. Your care partner should be available during the majority of the day for the first 2 weeks as you regain more independence and your joint heals. You are responsible for your recovery and should stay active. It is important to follow your recovery instructions to reduce complications. If you have an urgent question or concern, your first call should be to your surgeon's office, even if the office is closed. Your surgeon will have what is called an answering service to assist you and communicate to your surgeon or the surgeon available. If you are having a medical emergency, you should call 911. We will further discuss situations that could occur and how you should address them. It is important to know how to address potential complications. The most common complications following a joint surgery include blood clots, pulmonary embolism, infection, pneumonia, and hip dislocation. You will notice swelling on your surgical leg, which is the leg that was operated on. That swelling is typically controlled using ice packs and elevating your leg throughout the day. However, if you notice that you have swelling along with pain or tenderness in the calf when walking, Notify your surgeon immediately. If the pain is severe and your leg looks discolored, call 911, as you most likely have a blood clot that is causing damage by blocking blood flow. Blood clots form as a result of blood thickening and sticking together. Because you will be less active than normal, your blood can become thicker and clot. The pain from a blood clot is because flow of blood is blocked, which means the associated muscles are not getting enough oxygen and beginning to cramp. It is important to seek treatment so that you may restore blood flow to the area. A pulmonary embolism, also known as a PE, is a blood clot that has formed in or has traveled to your lungs. The most common sign of a PE is shortness of breath. As you feel short of breath, you may notice that you are breathing faster. This is your body trying to capture more oxygen. Another common symptom is sudden chest pain because your heart is working harder to try to move oxygen into your bloodstream. Confusion may occur because now your brain is not getting enough oxygen, making you feel lightheaded and/or dizzy. Communicate these signs of PE with your care partner so they may understand the importance of fast action. If you are having shortness of breath or chest pain, you should call 911 immediately. The ambulance team can begin treating you to slow the damage as they take you to the hospital. I am sure you are feeling concerned about the risk of blood clots and PEs, but we have a plan. The most common cause of blood clots and PEs is prolonged bed rest. It will be reiterated to you over and over while you are with us for your surgery that you need to walk as much as possible to reduce your risk of blood clots. In addition, your healthcare team will discuss performing ankle pumps while sitting, which helps to move blood in your lower legs. During your hospital stay, we will apply devices to your lower legs called sequential compression devices, or SCDs. SCDs inflate and deflate, alternating between the left and right leg in a pumping motion. You will be advised to wear them when you are laying in bed or resting at the hospital. SCDs are not prescribed for use at home. At home, your instructions will include walking as much and as safely as possible with your walker, and to take your prescribed blood thinner. A blood thinner is a medication either in a pill or injection form. You will likely receive your prescription for your blood thinner at your surgeon's office. If you are prescribed an injection, a nurse will review how to properly inject the medication and provide written instructions. We understand that you may be nervous about giving yourself injections. Communicate to your nurse your concerns, and they will do their best to assist you and make you feel more comfortable. Your pharmacist is another great resource and can review your blood thinning medication and provide written information. It is important to take your blood thinner as instructed for the entire time stated by your surgeon. If you are already on a blood thinning medication, you will receive further instruction from your surgeon about stopping the medication before surgery, possibly taking an alternative blood thinner and resuming after surgery. I have found that the best way to describe an infection is to picture a really angry sunburn. I'm sure we have all been unlucky to forget our sunscreen and end up with swollen, painful red skin. If your incision area looks bright red and is swollen and more painful than it has been, you probably have an infection. If you see green or white substance draining from the incision or on the dressing, and there is an odor, then you have an infection. A fever can often occur later in the infection process, so don't wait until you have a fever. If you notice any of the signs or symptoms of infection, you should call your surgeon's office immediately and inform them. They will guide you through the next steps. If this happens on a weekend or holiday, you will still call the surgeon's office and speak to the answering service, as mentioned earlier. It is important to address any signs of infection to prevent more serious complications. Your home health nurse will assess your incision and review the signs and symptoms of infection with you. Please note that infection education should be included in your discharge paperwork from the hospital, along with the surgeon-specific instructions on how to care for your incision. General home care tips on your incision and dressing care can be found on page 23 of your Total Joint Education booklet. The instructions from your surgeon and healthcare team will help you reduce your risk of infection. Be sure to keep your incision clean and dry. Infectious bacteria thrive in warm, moist environments, so you will want to protect your incision. This becomes particularly important with your self-care routines. The type of closure, i.e. staples, sutures, or tape, will determine whether you are allowed to shower, take a bath, or a modified bath with wipes and cloths. Knee surgery patients are more often allowed to shower. If you are instructed to wrap your knee, make sure that you secure a protective wrap above and below the incision and not on the incision. 1-gallon Ziploc bags cut to slide over the incision and or saran wrap are most commonly used for knee surgery and readily available home items. When using tape to secure the protective wrap, do not wrap too tightly as to restrict blood flow. If you plan to shower with your surgical leg extended out from the water, it is still recommended that you cover your incision. Hip surgery patients are often instructed to perform sponge baths until your incision check appointment at your surgeon's office. Again, you should follow your surgeon's instructions on self-care. After your bathing method, be sure to dry your body completely. When drying your incision area, you will take a clean towel or cotton cloth and pat the area to absorb all moisture. The movement performed in bathing may cause some bleeding at your incision, especially if staples and sutures are used. If you notice bleeding, pat the area dry with clean gauze and apply a dry dressing to cover the area. It is important that you apply clean clothing daily. Your care partner can assist you by making sure you have clean clothes available each morning and after your shower and or bathing routine. If you have had a hip surgery, be sure to change your undergarments as needed if they become sweaty or soiled. Your clothing should be loose and easy to take on and off to reduce straining your body and possibly causing injury. Remember, there are several assistive devices available for self-purchase that can make dressing easier if you choose. During this time, it is also important to not reuse towels. I realize the extra laundry may be a burden, but an infection is worse. Remember that a lot of the bathing restrictions and recommendations are only until your incision is healed, or about 2 to 3 weeks after surgery. Once your incision is closed completely, you have a much lower risk of infection and can return to a more familiar self-care routine while practicing safe body movements. Be mindful of pets in the home. Pets can carry bacteria on their fur and in their mouth, which can be transferred to you. Be sure your pet is not brushing up against your incision or licking the area. I realize this may sound alarming, but it is the reality of owning a pet. Make sure your incision is protected at all times. You will be advised to have any routine dental work completed no later than 3 months from your joint surgery, and to refrain from dental work procedures for at least 6 months after your joint surgery. If you require emergency dental work, you will be prescribed antibiotics. Please inform your doctor and/or dentist of any joint surgery plans or history. Pneumonia is identified as a preventable complication after surgery. Pneumonia becomes a concern because you are not as active as you normally are. Therefore, your lungs are not exercising and expanding as much. As you become more active throughout your recovery, your risk of pneumonia decreases. However, until that time comes, it is important to practice what we call pulmonary hygiene. As we discussed earlier, you will use your incentive spirometer, or IS, in the hospital to perform breathing exercises after surgery and will continue at home. Your goal is 10 controlled deep breaths an hour while you are awake for at least 5 days after your surgery. You will receive hands-on instruction on using your IS in the hospital. Additional education is available in your discharge packet. The symptoms of pneumonia are cough, fever, and shortness of breath. If you feel you have these symptoms, communicate to your surgeon or primary care doctor immediately. Be sure to take your IS home with you after surgery and use it as recommended. If your IS breaks or you realize you forgot to take one home with you, call Christina Phillips at 661-382-5051 and one will be made available to pick up at the hospital. If more convenient, IS are available for purchase at retail pharmacy stores and online. For those patients having a hip surgery performed, dislocating your hip is a painful result of not following your hip precautions. Page 23 and 30 of your total joint booklet contain details of hip precautions, and your surgeon will advise you as well on the allowed and discouraged movements. In addition to your hip precautions, it is important not to overdo your activity. Take it slow and progress over time, and of course, use your walker. The symptoms of hip dislocation include a sudden increased pain at the hip, an inability to walk, and the surgical site leg is shorter than the other. Many patients have noted that they heard a pop sound prior to discovering their hip being dislocated. It is important to not move or walk, but to call your surgeon's office immediately. Oftentimes, you will require an ambulance to take you to the emergency department to have your hip popped back in place. Please don't let the idea of an ambulance stop you from seeking help or trying to have a family member drive you to the doctor's office or hospital. It is vital to avoid putting weight on the leg to prevent damage at the joint or risk falling and causing other injury. One of the most common questions asked in the hospital is, what is your pain level on a scale of 0 to 10? We recognize that you are in pain from your damaged joint, and your pain level tolerance may be quite high. Please be aware that our goal in pain management is to have your pain at a functional level, meaning you are able to walk and actively participate in your recovery. Pain is expected after surgery. To assist with pain management, we incorporate multiple methods of care. Keep in mind that if your pain level is too high, you will not be inclined to move and participate, as this will cause even more pain. If you take too much pain medication, you may become too weak and dizzy to function, leading to a fall or injury, or worse, could become heavily sedated and unconscious, requiring emergency intervention. It is important to identify your pain level and to set realistic expectations about your pain goals. Medications will be provided in different forms throughout your surgical experience that are meant to reduce pain to a functional level. In addition, we will use ice packs to reduce swelling at your joint. These methods, combined with repositioning and increased walking, will help control your pain level. At home, you will be prescribed pain medication by your surgeon. Be sure to have your prescription filled as soon as possible so you can take it as recommended once at home. If you have concerns about pain management or experience with certain medications, discuss this with your surgeon as early as possible to avoid a delay in pain management. For additional information, review pages 20 and 21 in your Total Joint Education booklet. After surgery, your first visit to your surgeon is primarily focused on your incision. The appropriate care will be provided and may include removing sutures or staples if present. Your activity restrictions will be reviewed, and you will be encouraged to continue your physical therapy and walking. You can anticipate another visit with your surgeon to assess your overall progress at about 1 month after surgery. It is important to attend these appointments. Be sure to let your care partner know about all upcoming appointments, as you will be unable to drive yourself to them. Rest is an important component of the recovery process. Your body is trying to heal and recover from surgery. Please rest between your therapy sessions and take breaks as needed to elevate and ice your joint. However, it is important to not sleep too much during the day or lay in bed for excessively long periods of time. Remember the risks of blood clots, pneumonia, and increased pain when you are not active, and let that be your motivation to get up and move around. Walking after surgery, as we have said before, is one of the best activities you can do for yourself. Also, being active during the day will help you sleep better at night. A review of walking practice will be discussed here. It is important to make sure you are wearing proper shoes. Examples include shoes with a rubber sole and heel cover. Loose slippers and flip-flops are not appropriate. Your shoe should not slip or slide. If you can, invest in a good pair of sneakers that are easy to put on and take off. You may want to consider sneakers with Velcro straps, as lace sneakers can become a tripping hazard. It is not necessary to purchase an expensive pair of sneakers. You just need an appropriate pair. Keep in mind that your footwear will be restricted for at least 3 months after surgery. Be sure to walk on level ground, which is free of sand or pebbles that could slide from under your feet, potentially causing you to fall. Perform some of the exercises we discussed earlier before walking so that your body is stretched and loose. Walk at your own pace. Your recovery is not a race. You will progress daily if you work at it and eventually return to your normal activity level. Go slow and safe to have an enjoyable recovery. Keep in mind that however far you walk, you will need to walk back. Don't find yourself on the other side of the neighborhood unable to return home. In the beginning, it is appropriate to walk short distances in your driveway or inside your home prior to taking longer walks. It will take time to build up your stamina and strength. You might notice that using a walker can cause discomfort in your upper arms and shoulders. Keep this in mind as you are preparing for your surgery so you can include exercises that strengthen your upper arms. Be sure to have your walker fitted to your height by your physical therapist before you leave the hospital. Dress for comfort and for the weather. Make sure to hydrate with water before, during, and after your walks. Palmdale Regional Medical Center, our orthopedic surgeons and health team members understand that this is a lot of information to process. It is normal to feel overwhelmed at having to prepare and undergo surgery. The education provided is to help alleviate some of the stress you may be feeling. Today is a good day to prepare for your upcoming surgery. Reviewing the book and presentation with your care partner may reduce some concern and help you to feel more empowered about having surgery. Avoid drastic changes like a restrictive diet or intense workout routine. Make small changes where you can, like avoiding soda and drinking water throughout the day, or even adding a 15-minute walk in the evening. The ultimate goal is to help you have the best recovery you can so that you may start enjoying your new joint and the benefit it brings. This presentation was created to provide additional information to your total joint education booklet and the surgeon's individual instruction. If you have questions or concerns, please speak with your surgeon and/or surgeon's office about your surgery plans. If you have questions regarding the content or material presented, please contact Christina Phillips at 661-382-5051 or email christina.phillips@uhsinc.com. We are happy to help make sure you are ready and fully aware of what joint surgery means for you. This concludes our presentation. We hope you found it helpful. Thank you for joining us, and we look forward to seeing you soon. Enjoy your new joint.